Let's continue with our questions. Today you reached in your ward for a morning shift and you got your reports. So you have 4 patients to take care for today. So let's go to your 4 cases and let's see which one you have to assess first. Okay, you have a 36-year-old client with endocarditis who has a temperature of 106 degree Fahrenheit, that is 38.1 degrees Celsius, with chills, malaise and a heart murmur. And the next case you have is 40-year-old client with pericardial effusion who has a blood pressure of 84/62 mmHg and jugular venous distension. The third case, but number 3, you have a 60-year-old client admitted for pneumonia with a new onset of atrial fibrillation who has blood pressure of 130/90 mm of Hg and a heart rate of 110 per minute. And the fourth patient is 68-year-old client with an advanced heart failure who is receiving intravenous IV diuretics, has a blood pressure of 80/60 mmHg and the client is watching TV. So let's go, which one you will go and assess first. The first is pericardial effusion. The second one you have first one you have pericarditis, then the pericardial effusion, then you have pneumonia with the new onset of fibrillation, atrial fibrillation and advanced heart failure, intravenous IV, and the patient is with low blood pressure but watching TV. Okay, let's see whom you will assess first. So before I'm going to discuss about the options, let's briefly see what is cardiac tamponade. Cardiac tamponade means the filling of pericardial space with the fluid. Okay, so the fluid is shifted to the pericardial space, so then the heart is compressed, heart doesn't get enough blood to pump effectively or contract effectively and push blood out of heart. So that condition is very serious and it is fatal condition. Okay, let's say client with the pericardial effusion should be seen first. So that is our first, okay, the case. That was second option. Then the client is exhibiting signs and symptoms of narrowed pulse pressure. See the narrowed pulse pressure, the narrowed pulse, the pulse, the temperature, the blood pressure was 84/62. Okay, that was the difference between systolic and diastolic was really narrowed. Yeah, and jugular venous distension, all this patient was really symptomatic. There is hypotension and jugular venous distension of developing cardiac tamponade. These are the symptoms of developing a cardiac tamponade. So you have to identify this is a life-threatening situation, life-threatening complication, and pericardial effusion in which fluid build up in the pericardial sac and compress the heart. The heart is unable to contract effectively against the fluid and the cardiac output can be dropped drastically. Emergency pericardiosynthesis is needed. That's a treatment. Emergency pericardiosynthesis. You are removing the fluid from the pericardial space and letting the heart get more blood and contract effectively and supply to blood. So this is a life-threatening situation. You have to involve fast, call your medical practitioner and do immediate care and attention to this client. Okay, this will be the first client you should see. The important manifestation of tamponade include muffled or distant heart tones, pulses paradoxes, dyspnea, tachypnea and tachycardia. These are the other symptoms the patient will present. Option number 1 also should be seen, but what you have to see that already patient is symptomatic, so the murmur is there, so you have to see whether this murmur is changed or something is worsened, but it should be done after the kind of pericardial effusion was seen. Okay, then this option onset of atrial fibrillation should be reported to the healthcare provider, but first one should be seen before you attending the first case. Okay, atrial fibrillation often a chronic arrhythmia and is managed with ventricular rate control and anticoagulation. It's a treatable condition, but and less serious compared to pericardial effusion. And the fourth one, the client with advanced heart failure, of course the patient is on diuretics, so the diuretics will bring the blood pressure down. Of patient will be hypotensive, okay, the patient remain asymptomatic, IV diuretics still again can worsen the situation, because the cardiac output will be with reluctant low blood pressure. This patient will always have this low blood pressure plus the diuretics, that will worsen the situation. But here what you can, this patient is stable means because he is watching TV, so you can delegate this to some licensed practitioner who is with you. They can see the patient because of the hypotension, the patient has what is that, the patient may fall, so fall precautions you can it should be in place. So that's it. So pericardial effusion, the client with pericardial effusion should be monitored and assessed closely for the development of cardiac tamponade. Signs and symptoms of cardiac tamponade include muffled distant heart tones, hypotension, narrowed pulse pressure, jugular venous distension, and pulse paradoxes. Okay, now let's go to the next question. The nurse care for a client who had an abdominal aortic aneurysm. Aneurysm repair 6 hours ago. So this is a surgical case. So the patient had surgery for the aortic aneurysm, and it's already surgery done and graft is in place. So you are going to the patient after 6 hours, and the assessment finding would indicate possible graft leakage. In 6 hours you are noticing there is some maybe you will find this patient symptomatic with showing the sign of leakage from the graft. So what all the possible, so you have more than one, this is a SATA question, you will have more than one correct answer from here. So one is this one, ecchymosis of the scrotum. Second option is increased abdominal girth. Third is increased urinary output. Fourth is report of groin pain. Fifth is report of increased thirst and appetite loss. So ecchymosis. Now let's see endovascular repair of abdominal aortic aneurysm. This repair was done through the femoral access, and it's done endovascular repair was done. Okay, repair of the abdominal aortic aneurysm can be done via femoral percutaneous placement of a stent graft, endovascular aneurysm repair, or via an open surgical incision of the aneurysm and placement of synthetic graft. So graft placement is already done. With either procedure, an open surgery or a means endovascular access, both ways it can be done. The manifestation of graft leakage include ecchymosis of groin, penis, scrotum, or perineum. Increased abdominal girth, tachycardia, weak or absent peripheral pulses, decreasing hematocrites and hemoglobin, increased pain in pelvis, back or groin, and decreased urinary output. These are the symptoms you will see in patient with graft leakage. Okay, so option number 3, urinary output would be decreased due to inadequate perfusion to the kidney. So in blood not enough blood is going to the kidney for perfusion, so what you will see, it's not increase, it is output will be decreased. Okay, then that causes hypotension, then increased thirst and appetite. It is not relevant in this situation. So sign of graft leakage is important to monitor after repair of the abdominal aortic aneurysm, including the pain in the back, pelvis or groin, ecchymosis of the groin, scrotum or penis, tachycardia, weak or absent pericardial pulses, decreasing hematocrites and hemoglobin, increased abdominal girth and decreased urinary output. Okay, so the option ecchymosis of the scrotum was the first option, that is correct. Increased abdominal girth because the collection of blood inside and it increases, that is correct answer. Increased urinary output, that is it should be decreased. Or then report of groin pain, that is correct, groin pain is option here. Then report of increased thirst, that is not relevant here. So 3 options, okay, correct options. Then let's go to the next question, that is you are you are a community nurse and home care nurse, okay, visiting a house of an elderly client. Which assessment finding? You are there in her house and assessing this patient. There are certain findings you see, and you need to get you have to address this immediately. Okay, so let's see what are the uh, conditions you are going to see. The client cannot remember what was done yesterday, so forgetfulness for this patient. Okay, then next one is the client has a painful red area on the buttocks, so is early sign of a pressure ulcer. Then pressure injury. Then the third option is client has new dependent edema of the feet. Then fourth one, the client has a strong foul smelling urine. Strong foul smelling urine is indication that the client is maybe having urinary tract infection. So here the option number 3 is the correct one, because something a new dependent edema of the feet, that indicates that sign tell you that a new onset of dependent edema of the feet could represent a congestive heart failure. This is an urgent medical condition that need prompt evaluation for characteristic signs such as gaining weight, the lung crackles, and treatment. So you have to further assess about the patient, check patient weight and auscultate the lungs. Okay, then see the treatment what the patient is getting on. So all these things you assess fast and make a referral or get immediate attention for this patient. Then you can see one by one the other cases, like loss of short memory could be an early sign of dementia. Maybe the patient is going into dementia. Then it is important to assess client's mental status to ensure safety in their houses. Further interventions required, but this condition is not life-threatening. This is not a life-threatening situation. This mainly you have to focus. Means maybe the patient is maybe going into dementia, and maybe this is temporary due to something else. So, but safety is a concern here that you have to address also, and progress any progression of her memory loss also should be addressed. Then here a painful red area on the buttock represents the beginning stages of a pressure injury. Although not emergent, this does not require further intervention. It is important to recognize pressure injuries early and start treatment. So you saw the redness, and it's a beginning for the start of pressure injuries. So treatment should be instituted before the progress to advanced stages. Okay, advanced pressure injuries are it's difficult to treat and healing is slower. So pick up the problem as early as possible, not try to give treatment as early as possible. Then stop the progression, okay, or stop worsening the situation. Then the fourth option was a strong foul smelling urine is likely due to urinary tract infection. This doesn't require treatment to prevent further complication. This does require treatment to prevent further complication, but is not as urgent as the new dependent edema condition. Urinary tract infection can cause fever with confusion in the elderly. So not most of the elderly people you will see they are confused when urinary infection is when the patient elderly get urinary tract infection, they'll have fever and they are confused. Okay, so it's a very common symptom among the elderly. Now that's it. So let's go to the next question. So there's a nurse is caring for a client on the first day post-op after having minimally invasive direct coronary artery bypass mid-cap. Okay, mid-cap grafting. Okay, the client thought that this surgery was supposed to have much easier recovery and asked the nurse why it is so painful to take deep breath. What is the first response by the nurse? So this one, patient has a question. So you have to answer patient question, address patient's question and give him a correct answer for his question. So the mid-cap patient, why he is feeling too much of pain, that is his question. So the first, what you have to see, what you have to tell the patient is, that's you have to prepare answer for the patient. Let's see, the options are given, which one was the correct option. I am sorry, you have so much pain. I will go get your pain medication right now. Did you address the patient question? No, you didn't address the patient. You just assume that he wanted pain medication. No, that's not the right recognition or right addressing of that question. Now, next one is, let me call the healthcare provider to see if we can increase the dose of your pain medication. Did you address this one? You have to do your nursing assessment first, assess the pain level and everything. Then if there is medication is required, you administer that. Then you can call if further reference is required. Then that will be the third step you have to do. Now next one is, take deep breath while splinting your chest with a pillow and use your incentive spirometer every 2 hours. This will help your recovery. This is an instruction might have already given to this patient earlier, and he might be following that one. This is not the thing the patient is looking from you. He has a particular question for you to answer. So the next option is the last option. So that could be the correct answer. The overall recovery time is expected to be shorter, but initial post-op pain can actually be higher with mid-cap because the incision are made between the ribs. That is the answer the patient is expecting, or this is to make the clarity of the patient's doubt. Okay, so the incision was made between the ribs. That's why initially this will be more painful compared to the traditional CABG. Okay, so patient should be given this answer. Okay, so let me read it for you. Mid-cap doesn't involve an sternotomy incision. Mid-cap does not involve a sternotomy incision or a placement of a cardiopulmonary bypass. Several small incisions are made between the ribs. Several small incisions are made between the ribs, mid-cap. The thoracotomy scope or robot is used to dissect the internal mammary artery, that is used as a bypass graft. Radial artery or saphenous veins may be used if the internal mammary artery is not available. So this is how the procedure is done. Recovery time is typically shorter with this procedure, and clients are able to resume activity sooner than with the traditional open chest coronary artery bypass graft surgery. However, clients may report higher level of pain with mid-cap due to the thoracotomy incision made between the ribs. Okay, so so many small incisions between the ribs that causes the pain. Okay, and it is better recovery for the patient compared to the traditional CABG. Option number 1, the client may need pain medication, but this response is not the initial question. Okay, so I already explained to you that. Okay, now thanks for watching. I'll be coming with the next video soon, so keep waiting. Thanks.